Thank you, Mr. President, ladies and gentlemen of the Senate. During a recent visit to my family, my mom was telling me how grateful she is for her Medicare. I half-jokingly said, I wish I could get Medicare too. Then my mother got serious and said, I can't believe I'm saying this, but I wish you could too. That's because she has 4 daughters, and we all have very different insurance policies. My mom worries most about my younger sister, who works for a small nonprofit. Her monthly premiums and deductibles are so high, she doesn't have much money left over for office visits. And she's not alone. A Commonwealth Fund study found that 17% of Georgians are going without needed care simply because of cost. Georgians are paying dearly for insurance that doesn't give them the security or predictability that insurance is intended to provide. And we have deceived ourselves in believing that market forces alone will make sure good private plans are available at affordable prices. Instead, the market ends up restricting patient choice by pricing people out of their plans. Some of my constituents had told me that they might not keep their private plans if they had another choice. We should be willing to give them that choice. So, I'm filing today a bill to give Georgians more consumer power and flexibility. It's a Medicaid plan based on the Peachcare for Kids model, a plan people feel good about. In more technical terms, it's a Medicaid public option. This Medicaid public option would allow anyone, no matter their income or their insured status, the option to buy into Medicaid managed care, the same system that Peachcare for Kids uses. They will buy in at the same cost it takes the government to deliver the services. And that cost will be reliable because Medicaid is an efficient and predictable way of delivering healthcare services. Those who qualify for ACA marketplace plans can use their subsidies to help cover costs. And Medicaid will have to offer one managed care option that is the same as an ACA plan so that as people's incomes fluctuate and they move between Medicaid and ACA, they don't have to change doctors. And with more people going to the doctor when they need to, we can improve overall health in our state and reduce healthcare costs. Even the American College of Physicians, one of the largest physician associations in the US, supports a public option for healthcare. The overwhelming majority of Medicaid recipients are pleased with their healthcare, just as families are happy with their Peachcare for Kids. Let's give Georgians real options when it comes to paying for and getting value for their health care. Because when a family member is sick, whether it's a mom or a dad or a child, you shouldn't have to worry that you can't pay the doctor because you have both high deductibles and high monthly premiums. A Peachcare public option fills that gap. Thank you, Mr. President. I yield the well.